I witnessed, recorded, and produced these videotapes of the Washington, D.C. hearing. Their authenticity is above question.
This is produced as part of the ongoing work on the website, thewaythetruthandthelife.net.
This is a hearing about the government licensing the electrocution of people to cause grand mal seizures. Think of the millions of dollars, taxpayers' money, spent to pay psychiatrists and their supporters and for the worldwide travel in putting this conference together, while the victims and opponents had to pay their own way.
Yes, the gentleman back there. Yes, sir, please. I don't remember your name, I'm sorry. Dr. Peterson, congratulations likewise for such an excellent effort in such a short time. On page 11, the first paragraph, there is the statement ending our contraindications for ECT. I think there are a lot of shades of gray in medical judgment in all areas, and certainly in this particular area there have been a number of published accounts of apparent safety using ECT in most of these conditions when the overall risk-benefit analysis has been made. In my humble assessment of the risks, the increased intracranial pressure might be the only absolute contraindication. But again, risk-benefit analysis in any general circumstance is the appropriate approach rather than an absolute indication of non-indications. Now, the issue of the performance standards, I appreciate that the committee needs to rely upon data for most of the conclusions or suggestions for needs for data, but the data from the long of informed consent regulation in California reported for 7 complete years for more than 15,000 patients, for about 100,000 treatments, reflects that the use, I'm referring to page 13, and the application of court proceedings for the patient lifetime capacity to render their own decision for treatment. The no-holds-barred endorsement of court proceedings, I think, should be modified in view of the available data. And again, I remind the panel of the data that was provided to them in writing of the numbers reported by the California Department of Mental Health. If we're talking about quality of life outcomes, death, I think, has to be considered one of the important criteria for quality of life. 2 deaths have been attributed to ECT during those 7 reported years. 28 deaths have been reported attributed to regulatory obstruction of ECT during only the first 4 of those 7 years. This is published by the Department of Health. In almost all counties of California where hearings have been held for ECT consent purposes, the courts and the legal officials involved have never obeyed the time guidelines of the statute. Physicians are under the threat of penalty of loss of license if they are not obeying the consent procedures. Public officials have never been censured for delays of even months in writing a court hearing. So I think even if the recourse to court proceeding is considered desirable, that there must be an allowance for emergency treatment. Perhaps, as one of the speakers suggested yesterday, medical and maybe family decisions in the urgent situation might be allowed to proceed in life-threatening or health-threatening circumstances with a subsequent court hearing typically held as they are already at the time and convenience of the court system.
Can I just ask a clarifying question? You are suggesting that for the category of patient who we've identified as without legal competency to consent, that there nonetheless should be an exception for emergency application?
Absolutely. It seems really unusual for a consideration of health and human welfare to not reflect an important concern for life and death.
I'm looking for the audience of those people who made presentations specifically related to this area and who have been talked several times already.
One electroshock treatment can equal the energy of 3 pistol shots to the head.
Dr. Rose accepted 2 pieces of literature for reference. I would hope and might make copies available for the panel. We're talking about having a police factor information on the device and what we're using. And the one copy is the Thymatron, the brochure on a single sheet handout on the Thymatron pulse ECT device. And in there it shows the physical characteristics. I also included a current Winchester ammunition catalog because it shows the energy with which the bullets have. But running this machine at its maximum brings 201 joules of energy. That is 148 foot-pounds. If you're interested in actually understanding like the truth in lending and what they're talking about, 1 joule is 0.07376 foot-pounds. But what this means is this device, when operated at its maximum capacity, will lift a 1 pound weight 148.7 feet. The energy contained in that is equivalent to 3 25 caliber pistol slugs. Now that is just pure factor data. To give that lifting of 1 pound energy equivalence in informed consent, how could you not do that? And if you're going to give a procedure, the total energy and the total time are the physical parameters that characterize the device. How could you not include that information? And if a doctor prescribes a drug, he has to record the prescription. Why isn't the total time and the total energy recorded? This has been an experimental hazardous device for years now. Why hasn't this information been gathered that we could be talking with concrete objective facts rather than subjective opinions of psychiatrists and patients?
One electroshock treatment can equal the energy of 3 pistol shots to the head.
All right, out with your gun. Huh? Out with your gun.
Okay, this won't hurt. It'll be over in just a moment.
Uh-huh. What's that?
Conductant.
Oh, dabble, do you? Right, Mr. Jackson.
Open your mouth.
What's that?
This will keep you from biting your tongue.
Well?
Now just bite down on it.
Oh.
That's right. Just bite down.
Huh?
Now bite down on it.
Good. Are you ready?
Ready.